I'm Sarah Burnett and I'm a doctor, and 6 years ago I was put in the interesting position of looking at my own mammogram and finding out that I had breast cancer. So I have experience both professionally of breast cancer and also of being a patient. I was quite young at the time, I was only 43, so I also have experience of the slightly different position that younger women who are diagnosed with breast cancer find themselves in. Within the space of a week, I had a mastectomy and a reconstruction, and I had to go through the experience of telling my children and my family what was happening. 2 weeks after I had the mastectomy and reconstruction, I started on a course of chemotherapy which I went through for 5 months. Now, one of the things that chemotherapy does for breast cancer is that it stops your ovaries working very, very, very quickly. So I went from a normal, healthy 43-year-old woman to a menopausal 43-year-old woman without any of the kind of natural time that you might have to adjust to that. So I've had to look into a lot of the alternative therapies for menopause because taking HRT wasn't an option for me. In addition to that, I had to deal with some of the psychological and sexual ramifications of dealing with breast cancer and the change in your body that the surgery and the chemotherapy underwent. I took what I think was a probably very bold decision, in as much as I didn't bother to wear a scarf or a wig when I went bald for my chemotherapy. So again, I've had a lot of experience of dealing with the kind of external side of things when you're going through that. There's not a lot of support out there for women who've chosen to go bald during their chemotherapy, so I'm very happy to discuss anything that anybody wants to know about what it's like to go through that. I've been a doctor for over 25 years now. I've had significant health problems myself. I'm a mum, I'm a wife, and I'm also a master of neuro-linguistic programming. So I draw together skills from all of those aspects of my life, and I hope that I can help people and give advice and help find solutions for people. With all the experience that I've had, I'm in a really great position to be able to talk about breast cancer, how to deal with the medical side of it, as well as the psychological and the physical aspects of it. Also, I know a lot about osteoporosis and premature menopause and some of the alternative therapies that can be employed because I'm not in a position to use HRT or medical therapies myself. What I really enjoy about every aspect of my work, whether it's broadcasting, writing, is just meeting people and finding out their stories and then finding the solutions from my own experience and my knowledge professionally to be able to help anyone that I'm in contact with.